Let's talk about brachioplasties. Hi, I'm Dr. Pirko. Welcome to Ideal Plastic Surgery. Today we are going to talk about brachioplasties. Brachioplasties are one of those operations that is specially indicated for those people who have a very large excess of skin and fat on their arms. And it can also be performed on patients who only have a small amount of laxity, but in those patients we caution to make sure that we only do it if patients know that they have nice scarring. Because let's face it, unlike other surgeries where the scars are going to be hidden, a brachioplasty is not going to be hidden. You are going to wear something short in the summer and the scar is going to stick out for most patients. And while it is true that some patients could benefit from just a mini brachioplasty, the anatomy on most patients is going to show excess skin and fat going all the way to the elbow. And in those cases, of course, we cannot just do a short scar or something hidden in the axilla. We have to go all the way to the elbow. There are two possible scars. There is one scar that's quite popular that is placed right under the biceps, and that one is a little bit more hidden, but it has a tendency to get a little bit wider over time because the skin in this area is so very thin, and regardless of which suturing techniques you use, the thin skin with a little bit of tension could end up with a widened scar. The other option is to make the scar more posteriorly, and that is going to take skin that is a little bit stronger, a little bit thicker, and therefore give us less risks of having the scar widen over time. And depending on the findings on your exam, I'm going to advise you one or the other because we want to make sure that you have a great result. The surgery itself is going to remove all of the excess fat, and we oftentimes combine it with liposuction, not just in the area where we're removing the skin, but also in other areas of the arm in order to give you quite a slimmer arm that is going to make it easier to wear clothes and just look better. And it's going to remove a lot of skin as well. We are going to do this safely, which means that we're going to take a little bit of time. It easily can take an hour and a half to do a brachioplasty, and it's something that we can sometimes combine with one more surgery, like maybe a little bit of liposuction on the chest or even a lift or reduction, but we certainly don't do a brachioplasty in a hurry as an add-on to a large number of other procedures. It's an operation by itself. Surgery is done under general anesthesia. You get to go home in the same day, and after surgery most patients are going to take 1 week off work if they have something that isn't very physical. But if your job is very physical, you may want to consider a second and occasionally even a third week off work. To go back to the gym, we advise you to go after 4 to 6 weeks. With brachioplasties, our goal is to give you a great result with a very acceptable scar, and most importantly, without any sort of injury. There are nerves and important structures that we have to avoid during the surgery, and it does take a little bit of experience and of course proper training to do this the correct way. I am confident that our team is going to give you a safe, great result that you are going to love. The postoperative care after a brachioplasty is a little bit tricky sometimes. We don't have open wounds and all the sutures are dissolvable. Rarely will we use permanent sutures that we have to remove after a week or two, but in the majority of patients we can use dissolvable sutures. We have a little bit of difficulty sometimes finding the best way of putting some compression garment on this area because there is so much variability. There are patients of all sizes, all weights, all ages, and sometimes the standard size compression garments that we can find for the arms can be either too loose or too tight, and that can sometimes be a little bit tricky. Oftentimes what we do to avoid getting it wrong is we will send you home right after surgery with a wrap around, a strap that is going to have the right size, but also is going to be harder to carry every day because it could unravel. So we try to find the best suited compression garment, and if you already have one that you occasionally wear in order to make your arms look a little bit smaller, that might be the best one to wear right after surgery. We don't want anything that is super tight because that could literally make your arms and hands swell up. We just want some mild support that is going to make it feel a little bit more comfortable for the first 3 weeks while everything is healing up, because that's the time when there tends to be a little bit more swelling, a little bit more discomfort. It's not super painful. This is one of those surgeries where we send everybody home with 1 week of pain pills and no one really ever hardly asks for any refills. But it is definitely something that has a long incision, and because we use our arms and there's so much movement, it's something where you might find that the recovery is a little bit cumbersome. Not super painful, but definitely something to be aware of, and therefore we suggest that you plan on taking maybe 2 weeks off work, and maybe 4 to 6 weeks before you go back to the gym. Thank you for choosing Ideal Plastic Surgery for your brachioplasty surgery. We are the team with the most experience, and I am confident that we will be able to give you the best possible results. Thank you.